So the title of the paper that I'm critiquing is Effective Hormone Replacement Therapy on Cardiovascular Events in Recently Postmenopausal Women, a randomized trial. So are the results valid? I think that they were. The intervention and control groups did start off with the same prognosis. The groups were randomized and randomly allocated using sealed envelopes. Baseline characteristics such as body mass index and blood pressure were similar between the two groups. The only characteristic that appears significantly different was age, and the control group's average age was 50, while the treatment group's average age was 49.5. With regards to blinding, the study was open label, and so both the researchers and participants knew which treatment they were being administered. So, of course, this opens some room for bias. There was also quite a bit of change in the actual treatment group received by each group. So as you can see here in figure 1, those who were assigned to the treatment group, 236 of them still used HRT, but about 266 of them actually stopped. And there was a big change in the control as well. So 114 started using HRT, and 390 continued to be the control and didn't use the HRT. So they did use intention to treat analysis here. However, because there was such a big difference in the change from what they were actually assigned, I'm not sure how this could have altered the results. So a big disadvantage of the study was that it was stopped early. The study was intended to last 20 years. However, because other studies produced data that suggested more harm than benefit in HRT use in postmenopausal women, the trial was actually stopped after about 10 years. So they did continue to follow their participants for another 5.7 years through hospital records. However, after the 10 years, the randomization was lost. So, it's hard to know the exact validity of the 6 years after those 10 years of the trial. What are the results? So the relative treatment effect of HRT in postmenopausal women from the results appear to be clinically relevant in reducing the risk of mortality, MI, or heart failure. However, this could possibly be exaggerated because it was only the combined primary endpoints that actually showed a significant reduction. And when they were analyzed alone, so it was only mortality measured, when it was only MI or heart failure measured, they actually didn't have a significant reduction in the risk. So how can I apply the results to patient care? With regards to cardiovascular events, which is what this trial was investigating, all the important clinical outcomes are considered. So mortality, MI, or heart failure as primary, and stroke included as a secondary endpoint. I think it would be interesting, however, to have data on any changes to risk factors for cardiovascular events, such as a change in blood pressure or even cholesterol levels between the groups. The authors also investigated safety endpoints, including death, diagnosis of breast cancer, and admission to hospital for pulmonary embolism or a DVT. And interestingly, there was actually no significant difference found in these safety endpoints between the two groups. So I don't think the reduction of clinical endpoints is worth the increase in risk. Other studies have shown more risk than benefit, hence why the study was cut short. It was interesting to note, however, that when the groups were divided according to age, so those younger than 50 and those older than 50, the hazard ratio for the primary endpoints, as well as the safety endpoints, were lower for the women less than 50 compared to the women over 50. So this perhaps indicates that there could be more of a benefit than risk in those women younger than 50. However, more research really is needed to be done in the area.